Okay, so let's talk about, all right, the other parts of the axial skeleton. And we talked about the skull, so we're going to continue on with the vertebral column, one of my favorite structures in the body. It does provide quite a bit of upright vertical support, obviously. It's what gives us our upright posture here. All right? But don't forget, it does serve an important function in that it protects the other part of your central nervous system. The brain being the first part of your central nervous system in regards to the skull, protecting the brain. The vertebral column protects the second part of your nervous system, which is the spinal cord. Right? So it is made up of 24 movable bones. All right. Now, the sacrum, which is that triangular bone at the bottom, and also you have what's called your coccyx. It's often referred to as the tailbone. Those bones are what we call fused bones because at one point they were made up of individual smaller bones. All right. Sacrum was made up of 5 individual bones, and the coccyx varies, but it's at least 2 to 3 individual bones that eventually fused. Okay. So when we talk about the individual vertebra and the spine, all right, one of the relationships that we need to understand, all right, is that these vertebra, all right, will articulate with a bone above it and a bone below it. All right, so if it's above it, we refer to that as the superior vertebra. If it's the one below it, we refer to that as the inferior vertebra. You'll be hearing me use those terms quite a bit. So I really want you to kind of keep that in mind, okay? And obviously, one of the functions of the vertebral column is to actually hold your head up, okay? Specifically the cervical spine. So we're going to talk now about the different regions to the spine and some of the different curvatures that we are going to see inside the spine here. All right, so let me show you a couple views here. All right, so we're looking here at a posterior view. So if you're standing in front of me in line, all right, I'll see this view. Okay, here's the anterior view, and then the lateral view. So you can see, all right, we have a couple different curves. You have 5 curves: 1, 2, 3, 4, and then 5 down here. All right, so 5 curves. So we actually have 5 regions or divisions here to the spine. So you want to familiarize yourself with it. Because if I say the cervical region, you know, or the lumbar region, you need to know where those are located. Okay, so it goes cervical, thoracic, lumbar, sacral, and then coccygeal. All right, so the cervical is up by the head. That's going to be your neck. Your thoracic is going to be where all the ribs attach. So pretty much your chest area, your upper back. L lumbar, lower back. So lumbar is the lower back. And then you have the sacral, which is that triangular bone that sits, all right, at the base of your spine. And that's where your hip bones attach. Okay? And then your tailbone is the coccygeal bone, or the coccyx, and that is going to be right at the end there, at the bottom of the sacrum. So we'll talk about how many bones are in each region here. But for example, the cervical spine has 7 vertebrae, or bones. Okay? And so when we want to talk about a specific vertebra, right, we assign it with a number and a letter. Okay, so the first vertebra in your neck is C1. Okay, it's also known as the atlas. And then the last vertebrae in your neck, that'll be C7. All right, you have 12, and I'll go through this. There's 12 thoracic vertebra. All right, 5 lumbar. All right, and then the sacral is made up of, it's one bone, but at one point it used to be made up of 5 individual bones. And the coccygeal varies between 3 to 5. And they're all fused too. So we really just count the sacrum and the coccyx as just one bone each. All right, so keep in mind when we're talking about these certain regions, we'll give the letter, all right, for whatever region that it's in. So if it comes from the thoracic, it'll be T whatever. So if I'm talking about the first thoracic vertebrae, it'll be T1. If I'm talking about the last thoracic vertebrae, I'll call it T12. All right? So we'll talk about that as we go along. Okay. Yes, sir.
When do they actually fuse?
It varies, you know. Usually by the time you're an adult, there the sacral bone has fused. Now, in some cases, it doesn't completely fuse. So the coccyx, in some situations, can actually fuse onto the sacrum. So then the sacrum and the coccyx are all one bone. But that doesn't happen for everybody. But again, it varies like 20s and 30s for complete fusion. It's almost like, I don't want to call it like a growth plate closure, but you'll start to see them come together relatively soon. So here, when we're talking about the spinal regions here, you can see now where these are located in our picture here. All right, so the cervical region has our 7 vertebrae. So this top one is C1, and this bottom one here is C7. And then the thoracic region, it's easy to figure that out because you'll have ribs attaching to those vertebrae. All right, and this is often referred to as your upper or middle back. So you have 12 vertebrae there. Lumbar low back, you should not have any ribs attaching there. There's sometimes congenital ribs that can. All right, and you'll have 5 vertebrae there. And the sacrum is one bone. The coccyx is also one bone. But again, it varies. You know, at one point they were individual bones fused. All right, so that makes up our 24 individual vertebrae and our 2 bones. Questions so far? Not too bad? All right, let's talk about the cervical vertebrae. So these are going to be the bones that we find in your neck. And so the first cervical vertebrae, C1, also known as Atlas, and if you're familiar with Greek mythology, he was the titan that held the planet Earth on his back. There's actually a statue of him. I think it's in front of the NBC headquarters in New York City. All right, but he was a titan that held Earth on his back. Okay, so they gave, you know, the Atlas C1 holds the head, all right, on top. So then our last cervical vertebrae is going to articulate with the inferior vertebrae below it, the thoracic region, that'll be T1. So I could say the C7 vertebrae is superior to the T1 vertebrae. Or I could say the T1 vertebrae, I'm going to come right back to this slide, is inferior, right, to the C7. So here's T1 right here, all right, and here's C7 right here. So C7 is superior to T1. And if we go all the way down here into the lumbar vertebrae, here's L1. All right, L1 is inferior to T12. Okay? See what I'm talking about when we're talking about the relationships of how they sit? One's inferior to the other or one's superior to the other. All right. So there's going to be certain characteristics that we're going to learn about, and you'll be able to soon differentiate certain vertebrae from one another. You'll be able to see, oh, that's the thoracic vertebrae. It looks a lot different than a cervical vertebrae versus a lumbar vertebrae here. All right. So if you look here at our little slideshow here, you can see right here, cervical vertebrae right below the head in the neck region. There's no ribs that attach onto it. So that's one way to help you, all right, to differentiate the cervical vertebrae from the thoracic vertebrae. Right. Here you can see an X-ray view here, lateral views, side views of all the individual vertebrae here. All right, Atlas is the first one here, then the one that sits right below the Atlas, all right, is the axis, or also known as C2. So we'll go through all those different parts. The next region of the spine is the thoracic region. Okay? And this makes up the upper or middle back. All right? This region is inferior to the cervical region. All right? And you're going to see that these vertebrae are going to articulate with at least one pair of ribs. Some of these vertebrae will articulate, all right, with more than one pair. Usually it can be up to 2 pairs. Okay? But at least one. All right? So we have 12 of them, right? And they're numbered same way as we numbered the cervicals. All right? The lower number is going to be superior to the higher number. So T1 is on top of T2. Okay? T12 will will be below T11. And that last thoracic vertebrae, T12, will then articulate with the first vertebrae in the lumbar spine, which is L1. Okay? So keep that in mind. The big thing is you want to know that at least the thoracic vertebrae will articulate with 1 pair to 2 pairs of ribs. So if you see a rib attaching to a vertebrae, then you know you're in the thoracic spine. All right? Well, now there's certain pathologies and congenital defects, but we're not going to get into that in this class. You can have. Has anyone ever heard of a cervical rib? You can have a cervical. You can have C7 can actually have a small little rib coming off of it. And the first lumbar vertebrae can sometimes get a lumbar rib. You can get a small, tiny rib coming off of the lumbar vertebrae. But for our purposes, ribs are only in the thoracic spine. Okay. All right. So here you can see the thoracic vertebrae here. All right. All of these thoracic vertebrae will have at least 1 pair of ribs coming off. All right. So here's a nice picture of a thoracic vertebrae right here. And you can see it from the anterior view here. All right, the next region is going to be the lumbar vertebrae. All right, this is also known as your low back. All right, you have 5. Okay, so L1, which is the first lumbar vertebrae, will articulate with T12 above it. And then L5 is going to articulate with the first sacral vertebrae, which is fused. So it's just actually you could say that L5 is articulating with the sacrum. And in some cases, depending on where you are, who the doctor is, if you're reading an X-ray report or an MRI or a report, they might describe the sacrum as S1. So they'll say that sometimes too. Okay? So keep in mind, 5 lumbar vertebrae, no ribs, small of your back, all right, or the low back region. So if we look here, all right, on our picture, you can see that there are not any ribs coming off of the lumbar spine. Now look here, if you notice, let's compare. Here's a lumbar vertebrae. All right, look at this part of the lumbar vertebrae. It's called the vertebral body. It's huge. Look at the thoracic one. Look how small that is compared to the lumbar. Do you know why? Oh, explain articulates. Articulate is another term to mean touching or connecting. When 2 bones come together, they articulate with one another to form a joint. So one of the terms when we're describing a joint, we'll say articulations. So usually when 2 or more bones are articulating, they're forming a joint. So think of it like that. Okay? The reason, you're very welcome. The reason why this is big and fat is because that's a weight-bearing area. Your low back bears the weight of your upper half of your body. So the vertebral bodies are going to be fatter because in between the vertebral bodies are your intervertebral discs. Okay? So we can't see the discs on X-rays here, okay, but here are your vertebral bodies, and the space here in between is going to be the intervertebral disc, which is made up of fibrocartilage. You won't see cartilage very well on X-rays. You'll see bones very well, all right, but you won't really see cartilage. All right, so you can see here are the bodies of the lumbar vertebrae. Here are the disc spaces, all right, and then you can see at the bottom of the L5, all right, you can see the sacrum sitting right back down there. Speaking of the sacrum, all right, the sacrum is going to be, all right, at one point made up of 5 individual bones that have fused together. So at one point, if they were individual, we would label them S1, S2, S3, S4, S5, all right? But in all of my medical records, if I've gotten records from any radiologist or imaging expert, they have never said S4 or S5. It's always just the sacrum, all right, or S1, all right? So the sacrum is going to articulate with L5 above it. All right, and then finally, it's got 4 actual articulations. Articulates with L5, superior to it, All right, it'll articulate with the coccyx below it, and then it's going to articulate with your two hip bones lateral to it. So it's kind of sandwiched in there. It's covered on all sides. And the sacrum helps to make up the pelvic girdle. Okay. On our last, let me show you a picture of the sacrum. So here you can see it. All right, here it is sitting below L5, and then below the sacrum is the coccyx down here, and then lateral to either side of the sacrum are going to be your hip bones. All right, and the last part of the vertebral column is the coccyx, commonly referred to as the tailbone, although I've had some patients refer to their sacrum as their tailbone. All right. Point being is this is actually the very, very end of your vertebral column. All right. Again, no one really uses this nomenclature here. All right. But at one point, all right, it's a fusion of individual bones here. All right. So again, like I was saying to Robert here, it can actually fuse, the coccyx can fuse to the sacrum. All right. If you live long enough. But they say if you live long enough, you'll get cancer. So, all right. Any questions about any of that? All right. So you saw the bones, and you saw that there was a certain kind of configuration to the curvature of the spine. All right. So we're now going to look at those curves of our spine here. And you have four. Okay, the cervical, thoracic, lumbar, and the sacral curves. Right. There's also, I mean, if you really want to go all the way down to the actual coccyx there, because it does curve anteriorly, all right? But a lot of times people won't even consider that, because a lot of times they'll consider the coccyx and the sacrum in one bone, all right? But there is a curvature there. And without going into all the physics and engineering of the spine, it's these curves that give the spine its incredible flexibility. All right, even though you don't really think, especially in the thoracic spine, that you have a lot of flexibility movement because the ribs kind of get in the way. All right, but all those individual joints do provide a significant amount of flexibility, and they allow us to bear weight as much as we can. If we didn't have these curves in our spine, right, we would be having, believe it or not, and some people are like, oh, I got backup problems. I said, listen, if you had a straight spine, and when I say straight spine, just up and down, not this curvature, if it was your lateral curvature, you have, all right, these different curves here. If instead, all right, of that, your spine looked like this, you'd have problems, okay? Just by the physics involved and the engineering. I'm not an engineer, all right? But the fact that we have those lateral curves allows us to withstand a lot more stress in those regions there, all right? So when we're born, you have your one curve, all right? This is going to be, I apologize, this is going to be a horrible drawing. It's supposed to be the nose. So when you're a baby, you look like this, all right? Here are the little arms, all right? So you're born with what we call the primary curves of your back, all right? So the primary curves come from the thoracic and the sacrum. So it looks like a C, okay? So over time, you're going to develop your secondary curves, all right? And those secondary curves come with certain milestones in your life, all right? So keep in mind, when you're born, just like that horrible picture that I just drew here, all right, you have that C-shaped curvature there. Okay, that's what you look. That's supposed to be here, by the way. All right, so that's what you have. All right, so you have your thoracic and sacral curves make up this primary curve here. Now you start to undergo certain milestones. What's one of the early milestones physically? Not talking about talking or smiling, like physically. What's one of the earlier things that a baby does? Go before crawling. Go even sooner than that. They raise their head. Yeah, they start to develop strength in their neck. So now they go from here, all right, so now they start to develop one of their early secondary curves. They start to raise their head up. Okay, so they start to develop this curve, the cervical curve. That's a secondary curve. What comes after sitting up? Standing, walking, right? That's when they develop the other curve here in the lumbar spine. Okay, that's when they start to get, all right, here's the thoracic curve, here's the lumbar curve, that's back to the sacral curve. I mean, it looks awful, I know, all right? But this is them supposed to be standing up, all right? It looks like that. Actually, let's not skip that. There you go, okay? So when we start to undergo certain milestones, raising the head up, that's when you get your cervical curve, okay? So you start to get that anterior curvature there. And then when the child starts to stand and walk, that's when we'll get their other secondary curve, the lumbar spine. So essentially you went from looking like a C, like that, right, to actually having, I'm going the wrong way. So you went from having that C shape, all right, configuration, then you started to develop your secondary curves here. That lateral curvature there. All right, and because of that, and it's amazing how, one, adaptation, the body, genetics plays a huge role, all right, it just knows. I was sitting, I don't know where I was, just thinking like, how the heck does the radial artery and the ulnar artery, those are arteries in your forearm, how do they know where to go? Like when you're growing and developing and starting to develop a circulatory system. It's just amazing. I mean, there's chemicals, I won't get into it, but it still amazes me that all of us in this room are somewhat normal. I can't speak for you guys, but you know, I mean, it's just amazing, you know, that I don't have my ear on the top of my head. Like, how did it know to go here? You know what I mean? It just, there's reasons, you know what I mean? Okay, so here are your primary, secondary curves, all right, which leads me into spinal curve abnormalities, scoliosis, lordosis, kyphosis, all right? So this first term here is kyphosis. This is that old lady that you see that hunches over horribly, right? And what that is referring to is the thoracic curvature. Okay? A lot of it is going to be postural, but eventually, you know, you get old enough, osteoporosis, which is going to play a role, especially in females and older females, right? Especially if you're predisposed genetically. Right? That will play a role in this formation of that thoracic curvature there. Okay? So it's all, you know, that's that person that has that hunchback appearance. And I don't know why it keeps popping up on my email. I keep getting this ad for this woman. I mean, she looks bad. I mean, she's bent almost over at 90 degrees. And then she underwent some program for whatever, and now she's standing up normally. But she looked bad. It's got to be CGI. There's no way that lady made that significant improvement. All right, lordosis and scoliosis. When we talk about the lordosis, L lumbar spine. All right, we see this, all right, in middle to later ages because we will start to collect weight around our midsections, especially for men. Men, we put our weight around our midsection. Ladies will put it more on their hips and on the backside. Okay, so that kyphosis. That lordosis is when we start to get that sway back position there because you're swinging your abdomen out, you're trying to counterbalance that by leaning back. Scoliosis, we hear this all the time, at least when I was in school. I don't know if they still do scoliosis testing. They used to make you bend over and touch your toes and put this thing on your back, and they would see if you had scoliosis. I still, to this day, don't know if I had a score or whatnot. But in this type of situation, a scoliosis is going to be any side-to-side curvature. All right, lateral curvature. And depending on how bad it is, if it's only like 8 degrees, it's not too bad. That's where it stays, that's where it stays. I've got a patient, he had 75 degrees, bent almost in half, bad. He was one of the last people that went down to to Texas, and he had what they call Harrington rods. They put them in the spine. There are these 2 rods that go on either side of the spine, and they drill screws into the spine, and they straighten your spine out as best they can. He's still pretty bad. But he went from like that 75 degrees to like 30 or 20, which is huge. But he's like in his 60s. But anyways, so they, in really serious situations, they'll have surgery. Shriners is doing this awesome program now in which they brace the patient. So they take a curvature measurement and they make a brace specific for that patient. It's like a body cast. And they put the patient in that for 6 months. Then they come back, take an X-ray, see if there's an improvement. If there's an improvement, they make them a brand new brace, and it slowly starts to straighten them up. It could take years. It could take, I won't say decades, but it could take, you know, it depends on how bad the curvature. And they're having a high success rate. So it's really kind of neat. So here you can see the examples here. Here's that kyphosis there, all right, that hump back there. Here's our lordosis, that increased curvature there in the lumbar spine, and then our scoliosis, that's side to side. You want to see some pretty bad examples? Here you are. There's that kyphosis, all right, lordosis. Now scoliosis can be, you can have an S-curve scoliosis like this patient has, where it just kind of goes back and forth like that. You can have a C, where it's just one big C. Oh, here, I'll show you. There you go. Okay, so this is an S-curve, double S-curve, it just varies. Understand though, whenever you get lateral flexion, when the spine moves to one side, you're going to get twisting of the spine. All right, it's just how it's designed. All right, let's talk about some stuff here. Some common features of our vertebrae. Now, all the words up there that are in bold are common to all of the vertebrae. Okay? Well, yeah. So, our first one here, body. That's that big portion. I'm going to come back and forth here. Check it out real fast. Here's the body. All right. Here's a typical vertebrae. Understand that we have typical vertebrae and then what we call atypical vertebrae. We're going to start with the typical vertebrae first. All right. So here's the vertebral body, right there. Okay. Then you have the vertebral arch, which is on the back side of the body. And like an arch, it's going to have this type of arching type of appearance to it. So if I go right here, okay, your vertebral arch is this whole part right here. That blue line is, okay? So it's posterior to the body. So if you see on a test and it has that line there, arching in the back portion, that's what they want you to say. All right, that's the vertebral arch. All right. Then you have the vertebral foramen. A foramen is an opening in the bone, right? And something's going to go in that hole. So that's what we see here. Here's our vertebral foramen. So now, if we stack a whole bunch of vertebrae on top of one another, okay, now all these vertebral foramen, they line up. They're like more like a tunnel-like structure. So we give that a special name, and we call that the vertebral canal. So we stuck a bunch of vertebrae on top of one another, and in the vertebral canal is this beautiful structure, spinal cord. Okay? So one individual vertebrae, all by itself, that's the vertebral foramen. But now if we were to stack 8 vertebrae on top of this one, right, it becomes this same structure becomes like a tunnel now. All right, and that's where your spinal cord sits. Okay? So a couple other structures here that you need to be aware of. All right, here's a vertebral body. All right. Then you can see on this back part here, if you're ever feeling your back and you feel the bones right in the middle of your back, that's this right here. That is the spinous process. All right, the spinous process of those bones that you'll feel right in your back. All right, then you have these processes coming off to the side, and those are the transverse process. Here and here. In between the spinous process and the transverse process, here and here, that's called the lamina. Okay? Actually, both the lamina during development will fuse together and form the spinous process. If you don't get complete fusion of the lamina, you get a condition called spina bifida. Has anyone ever heard of spina bifida? Yeah, and it varies and severity. Because in some cases, spina bifida, you can have the spinal cord, the baby's born with the spinal cord outside its body, and it's almost, I hate to say it, dead on arrival because it won't survive very long. All right. Then, if you see here, all right, these little kind of smooth-like structures, I'll show you better views of them. All right, that's the facet, and that's going to be a joint because it's going to connect to another vertebrae and create a joint. So these are the facets, and then pretty much this and this are referred to as the pedicles. All right, I'll show you on some other models. This isn't the best one for some of these structures. Okay, so if you have your atlas, you might want to start labeling because there's a lot of stuff on here. So just to let you know, this right here is a lumbar vertebrae. Why? Huge vertebral body. Look at the size of that body. It's big and fat. Like my Rottweiler's head. Okay? Big old vertebral body. Okay, because we got some big old discs that are going to sit there. All right, so we've got our vertebral body. Then behind it, you got this big old hole here. That's the vertebral foramen. All right, spinal cord travels through that area. All right, then you've got, let's do the processes. You got this process coming right off the backside of the vertebra. That's the spinous process. Then you got these processes that are coming off the sides of the vertebra. Those are the transverse processes. Here and here. Then the part of the vertebrae found in between the transverse process and the spinous process here, that's the lamina. Okay? And then finally, immediately behind, all right, the vertebral body, part of the vertebral arch right here, that is the pedicle. Here, it's essentially between, all right, the vertebral body and the transverse process. So the pedicles make up the lateral boundaries of your vertebral foramen. All right, the lamina make up the posterior boundary of the vertebral foramen, and then the backside of the vertebral body makes up the anterior boundary of the vertebral foramen. Which oh yeah, you got it. Yeah, I know you got to split. This is the front, and this is the back. Oh, I know what you're talking about. The vertebral arch there. Yep, it includes all of this right from here. So it basically goes from the back side of one part of the vertebral body, it goes all the way around to the other side. That's going to be the vertebral arch. All right, so I do want to talk to you about what articular facets are and what articular processes are. Okay? All right, so articular facets and articular processes. The articular facet is part of the articular process. It is the smooth, flat surface found on the articular process. Okay? So an articular process, I'm going to use a hold up. I use the whiteboard here. Okay? The articular process is so here's the bone here. All right, and you've got this bump coming off the bone. That is a process, right? We all agree a process is a projection of bone coming off of a bone, okay? So that would be our articular, this whole thing here is the, pardon me, this mouse sucks. This whole thing here is the articular process. But if you look close at an articular process, all right, so say we're looking at, this is the articular process from the backside, you'll see a smooth area on it. Okay? Think of it like your thumbnail or fingernail. So your thumb or your finger is the process, your nail is the facet. Okay? It's a smooth, flat area on the process. And it's smooth and flat because it's going to make a joint. It's going to articulate with another bone. Remember, we want our joints to be smooth. We want them to be nice and flat. We don't want them rough and bumpy because then they'll grind together. Remember, you want to drive down that nice paved highway, not in South Carolina, probably in another state, compared to like a dirt road. Okay, that's what we want our joints to be, like a highway, right? Smooth, right? So that's what the facet is. The facet is going to be that smooth, flat surface there. Why aren't you doing it? Oh. Okay. You guys good with that? I got to scroll down like 80 slides. Not even that. I got to scroll down 240 slides, people. It's a big slideshow. Come on, get out there. All right, so the process is the bony projection. The facet is the flat surface on that bony projection, like your fingernail on your finger is the facet, and the finger is the process. Okay, so we're going to go and look, all right, when I'm looking at some of these, there we go. All right, so what this slide is showing us is, all right, let's come down to the bottom view first. Here's a vertebrae from the side view. All right, so this whole thing right here, that is the superior articular process. Over here, this is the inferior articular process. It's that bony projection. Okay, so you can see it here, and you can see it here. This is the superior. You barely see the inferior on this superior view there. All right, are we good with that? Okay, so I'm going to be showing you some more stuff here. All right, so we've seen all this. All right, now we're going to add in that structure that I've circled. This is the lumbar vertebrae. This is the top of the lumbar vertebrae. That is the superior articular process. That whole thing in that circle. Now, if you look close enough, you can see, here's the superior articular process on the other side. There's a smooth, this is a smooth area here. All right, so basically this, what I'm highlighting here, which is not the whole process, that is the smooth area of that process. Okay, so that area is going to be the superior articular facet, which is on the superior articular process. That's just basically the joint surface, because if we put another bone in there, that's where the two bones are going to connect with one another to form a joint. They call them the facet joint or the zygapophyseal joints. Okay. So a couple other structural features that we are going to talk about. We've seen foramina, but now we're going to introduce what's called intervertebral foramina. All right? And so this is when we take two vertebrae, we connect them to one another, and from the lateral view, we see a hole form. And this is where, here's your spinal cord, and your spinal cord gives off these nerves, those are called spinal nerves. Well, they leave the spine, and they go out through these holes here, okay, at every level. Okay, so there are basically a passageway for these spinal nerves to exit from the spine and go out to the body. Go out to your arms, go out to your legs, go out to your kidneys or whatever. Okay? All right, the vertebral arch. Already talked about that. It's made up of the pedicles and the lamina. Basically, just everything on the back side of the vertebral body. You just go from one end of the vertebral body to the other. Okay? And that's going to be, first part are going to be the pedicles. The lamina are going to be back in the posterior region there. So if you want to see the intervertebral foramen, you can't just see it with one vertebrae. You need at least two. All right, so if we put, all right, a couple vertebrae together, here you can see, here's a vertebrae here, here's another vertebrae here. When we stack them on top of one another, it makes a foramen. Okay, and these little blue, greenish colored dots are representing the space, but also the spinal nerves. So they'll exit out of the spine through here. Okay. At the same time, here you can see the intervertebral discs sitting in between, all right, the vertebral bodies. What type of cartilage is the intervertebral disc? There's three types of cartilage in your body. This is one of them. The weight-bearing, compression-resisting cartilage. Hyaline cartilage. No, not hyaline. Sorry. Fibro cartilage. Okay. So, a couple other structures. We are going to see the spinous process. That's that little bony projection that comes when both the lamina fuse together off the back, all right, of your spine. All right, the transverse processes, all right, they come off laterally. And then you have your superior and inferior articular processes. All right, these will be found in the vicinity of the pedicles and the lamina here. All right, the smooth surface is the facet. Okay, so what you'll say is the inferior facet, all right, let's say the inferior facet of T12 is going to articulate with the superior facet of L1. Because doesn't L1 sit below T12? Right? Okay, so here's T12. This is a horrible drawing. But here's the inferior facet off of T12. T12. And then here's the disc will sit in here. And then L1 sits right below it. All right, and it's got its superior articulating process that comes off of it and articulates with that inferior articulating process of the superior vertebrae. Okay? Intervertebral discs, fibrocartilage, and think of it as a donut. Our fibrocartilage donuts, all right? I don't like jelly donuts, I like glazed donuts, not that you guys care. But anyways, at the center of our fibrocartilage disc, you have what's called the nucleus pulposus, and that's our jelly. And it's surrounded by the annulus fibrosus, and that's going to be that fibrocartilage ring. So, and when you hear somebody saying, I got a disc herniation, that's what they're talking about. What will happen is a little crack will appear in the fibrocartilage, and that jelly will squirt out. Just like that. Makes that noise. You got to listen carefully for it. But it does. I've heard it. All right, no, this is my dog. All right, so that's intervertebral discs. Okay? All right, we've labeled that. Oh. Boom. See these vertebrae up here? I can't say I can guarantee this anymore, but it's very likely that some of you may get a question. Oh, actually, no, I take that back. A lot of the questions on the bone test for lecture will ask you, they're two-parters. They'll ask you, one, to identify the region of the spine that you will find this vertebrae in. And I can guarantee you you'll have at least 5 to 8 questions. All right? We'll say, name the structure, name the spine. Name the region of the spine that you'll find this vertebrae in. So it'll be pointing to, here's an example. It'll be pointing to the vertebral body here. So you have to say, that is the vertebral body, and it's found in the lumbar spine. Okay? So when you're going through and you're looking, all right, at these slides, All right, in your atlas, you better make sure you know which is the lumbar, which is the cervical, and which is the thoracic. That's half the question. You'll lose half the points right there if you can't tell what region of the spine we're in. Okay, I can promise you that. Okay, so by looking at this, you'll see a couple things. Real easy. See these holes here? Those are called transverse foramen. We're going to see them in a bit. All right, you don't see them in the thoracic and the lumbar. Okay, not in the thoracic and lumbar. So if you see holes here, you know you're automatically in the cervical spine. Okay, and then you can look at the bodies here. Cervical spine, not too bad. Thoracic's a little bit bigger, but look how big the lumbar is. It's huge. Okay, and the lumbar has a short, stubby, all right, spinous process. Believe it or not, you can't tell, but the thoracic one is really long. Okay, so study some of the characteristics of these vertebrae here, right, and make sure that you are that you're familiar with them. Okay, all right. So we're going to start off in the cervical vertebrae here. We're going to start going through. So we'll do some labeling too, but we're going to talk about some of our atypical vertebrae, the atlas and the axis, the first two cervical vertebrae here. Okay. So a couple characteristics here of the vertebral column when we're dealing with the cervical. All right, these guys are usually the smallest. All right, but they do have this right here. Transverse foramina, which is a hole in the transverse processes. You need to know this because I just got done teaching it to my 211 class last night. You need to know what runs in that transverse foramen, the vertebral artery and the vertebral vein. The vertebral arteries, because you have a left and a right, supply 20% of the brain's blood supply. Okay, it's significant. So the vertebral vein is going to help to drain, all right, the blood supply from the skull. All right, so this is a big characteristic, that transverse foramina. What's that? That's this, right here, this hole. That's holes. Okay? All right, so let's talk about our very first atypical vertebrae. It's the atlas. Now, again, if you get on your test a picture of this and it says name the vertebrae, you can say atlas or you can say C1. Easy, right? Cool. But either one is acceptable. Okay, this is the one that sits right beneath the skull, the occipital bone. Remember we learned about the occipital condyles? Those are those knobs that sit on either side of the foramen magnum. Okay, they're a rounded structure, so they look kind of like this. They hang down off of the occipital bone, just like that. Okay, so when they articulate with C1, and I'm talking about the occipital condyles, they form what we call the atlanto-occipital joint. And it's responsible for flexion extension of the neck, which is yes. Nodding your head, yes, dear, yes, dear. All right, that's what it does. Okay. So it articulates. The occipital condyles are going to articulate with these structures here. You need to know these. These are called the lateral masses, and let me show you what that is. All right, before I go on. All right. Here's the atlas. Okay. And you can see where it's located, right here. Very first vertebrae of your neck. Okay, here's the atlas. So here, take a look. Here you can see these structures right here. These are the lateral masses. Do not, I know someone's going to do this, but I'm going to say it anyways, do not call them the superior articulating process. That's not what they're called. They are called the lateral masses. And your occipital condyles sit in them. Here and here. Okay? Makes a cup. Your spinal cord is here. All right, so you have these processes that come off the side here of C1. Those are the transverse processes. Well, guess what? Those transverse processes have holes in them. All right? And those holes are called the transverse foramen. Good? Simple? You're going to rock this. This is C1, cervical region of the spine. That's half of your question. All right? Okay, so C1 has a vertebrae that sits below it, known as C2. But guess what? We give it a special name. All right, we are going to call C2 the axis. All right, because C1 swivels around it. All right, it spins around it. So the joint that it forms, all right, is the movement of shaking your head from side to side. No way. No, no, no. Okay? So we are going to see the name of that joint is called the atlantoaxial joint. All right? Now, where C1 or the atlas articulates with C2, that structure is called the dens. It's a process. It's a bony process. All right? So you call it the dens or the odontoid process. I know what I want to call it. 4 letters, easy. Easy. Okay? But it is a pivot joint. Okay, so the dens acts as that pivot point for that lateral rotation. All right, the majority of when you shake your head from side to side, no. All right, the other vertebrae in your neck help with that, but the majority of it, close to 85 to 90% of that motion occurs at that one joint. It's impressive. It's impressive. Okay, that's the axis. So let's take a look and see what this axis looks like after I take a drink. Okay, so here you can see there's the axis. This is C2, right? Kind of, again, it has a unique shape to it, and you can see here it is. But if you look, if you notice, if we look closer in, all right, we can see, all right, that here's the axis, but look, here's the atlas. All right, so it kind of moves up into the atlas here. We'll talk about that, but let's go over and do some individual labeling here. All this should be labeled, all right, or we will be labeling here as I go through. All right, a couple things. Here's the vertebral body of C2, right here. The dens, or the odontoid process, sits on top of the vertebral body. Okay, so here's the vertebral body. On top of it is the dens. Okay, lateral to either side is the superior articular facet. That's what that's pointing to, that smooth surface there. All right, now if there was a circle around the whole thing, then that would be the superior articular process. But the smooth surface there, you will not get it wrong. If it's pointing to that smooth surface and you wrote facet, and the computer might mark you wrong, but I won't. All right, unless there's a question attached to it and it asks for you to specifically call it the process and you call it the facet. Then I can't help you. Got to read the questions. Okay. So we've seen a couple other of these structures because we've seen in other vertebrae. Here's this opening here. That's the vertebral foramen. Okay. And then off the body, we have the pedicle here and over here. All right, and then back here on the posterior part of the vertebral foramen, we have the 2 lamina. Here's one lamina, here's the other lamina. Where both laminas fuse, all right, here's one lamina, here's the other one. They come together, they fuse, and they form this. Now, if you look, bifid spinous process, what the heck is that? All right, when the spinous process has this shape at the end, 1 nubbin, 2 nubbins. All right, and we refer to that as a bifid spinous process. Okay, bifid spinous process. All right, then we can also see here, coming off the bottom of the vertebrae, that's our inferior articular process. So C2 has a lot of stuff on it. Now this isn't very good, this transverse foramen. You can barely see that. I would not ask that of you. All right, you got to be able to see what the structure is in order to label it. All right, so this is, again, it's indicating that you can't see that hole there. All right, so I would never ask you that. All right, so we've talked about C1, we've talked about C2. All right, I want to show you the relationship between both of them, all right, on how one sits on top of the other. So here you can see, here's C2 all by itself. Now what we're going to do is we're going to take C1 and we're going to lower it on top. All right, so you can see how the odontoid process of the dens kind of pokes up and it sits right behind the anterior portion of C1. All right, and you have this ligament here called the transverse ligament, and it basically will hold, all right, the dens up against, all right, C1 here, so it can swivel, causes that pivot rotation. You have this picture in your book, I believe, in the atlas, to kind of give you an impression of what we're looking at. So again, we're just going to see here's the transverse ligament. It just wraps around the back side of the dens here and holds it into place. All right, C7 is also known as the vertebral prominens, and that's because, if you can do it on yourself, if you reach back and feel that bone sticking out of the back of your neck, that's C7. It's that spinous process. That's all it is. It's the spinous process. It's a very long spinous process. Because what happens as we move from one region of the spine to another region, the vertebra in the lower portion, for example, the cervical region, the vertebra in the lower portion of the cervical region start to take on the characteristics of the thoracic vertebra. All right? So if we go into the thoracic region, as we get to the vertebral bodies of T10, T11, T12, they're starting to get bigger and bigger and fatter because the lumbar vertebral bodies are bigger and bigger and fatter. So they start to transition. As you move from one region to the next region, all right, they start to take on the characteristics of the next region. That's what we're discussing there, okay? All right, vertebral prominens, you can see it right here, sticking out, right there. All right, so here, whoops, let's make that disappear. All right, so this is a typical cervical vertebrae. So you should be able to identify all of these structures labeled here. This is not a perfect example of a bifid spinous, only because the one nubbin is busted off, but if it was there, it would look like that. All right, make sure it looks like that. Make sure if it looks like this, that's not a bifid spinous, only if it's got the two little nubbins hanging off the bottom. Okay, so this is typical. You'll find all this stuff on all of the cervical vertebrae. Okay, they'll have a vertebral body, they'll have a vertebral foramen, they'll have a lamina, a pedicle, transverse foramen, transverse process, and then the articular processes and the articular facets. Yeah, see, if it's pointing, like this is a perfect example. If it's pointing on the test to this surface area, all right, you're pointing to the facet, okay? So if you were to type in there superior articular facet, you're not wrong. If there was a circle around it and it says name this structure, then it's referring to the process. They want the whole bony projection. To be honest with you, I like to show it from the lateral view like this. Okay, this is a much better, look at that. See how this one arrow is pointing to the flat surface there? And then this other arrow is pointing off to the side. It's not the flat surface. It's actually referring to this whole thing here. You won't be wrong if it's pointing to the flat surface and you say facet. Okay, you just got to make sure it's the right facet. All right, if it's asking for the superior and you put inferior, that's wrong. All right, again, I don't like this transverse foramen view. You can't really see it. You know it's down in there, but you can't really see it. It's not the best. But you need to know it. And so this is what's showing us down here. All right, this smooth, flat surface, that's the inferior articular facet. Okay, this whole region here is the process. All right, you guys good on that? Structures labeled. Okay. So that's it for the cervical spine. All right, we've seen the two atypical vertebrae, C1 and C2, the atlas and axis. All right, we just finished up the typical vertebrae. So now we're going to go into the thoracic vertebrae. Okay, and there's no atypical thoracic vertebrae. It's going to be pretty much what it is. All right, so we have a total of 12. Okay, you do not have to worry about the costal facets and the demifacets for identification purposes. But basically, these facets, the costal and the demifacets, have to do with where the ribs articulate onto the thoracic vertebrae. Okay? Some of those are going to, the ribs are going to articulate directly to the side of the vertebral body. Okay? Some, all right, will also have an articulation with the transverse process. And I'll show you that relationship when we get to the ribs. I'll explain this more, all right? But when we talk about costal facets and demifacets, that is where ribs articulate to these bones here, all right? So basically, the head of a rib is going to articulate with the costal or the demifacet. We'll get into that later on. That's for ribs. All right, so take a peek here. You can see, all right, we've seen a lot of these structures already. Vertebral body, okay? Here is the transverse process. Here's the spinous process, all right? Here are the laminas, here and here, all right? Then you've got your pedicles here, all right, and here, all right? The smooth portion of the superior articular process that this arrow is pointing to is the facet. You can see it really nice over here. Okay, again, costal facets you are not expected to know for identification purposes for the lab test, but you should still kind of know, all right, where they're at. All right, you can see the small, smooth, rounded or indentation. That's the costal facet. That's where the head of the rib is going to nestle in. Okay, and then over here you can see you've got a little bit of a indentation that's smooth. That's, all right, where the costal tubercle, all right, which is on the rib. So the same rib can potentially articulate with one vertebrae in two different spots. It'll make sense when I show you the picture. You'll be like, oh, now I know what the heck you're talking about, Dr. Collins. Okay, all right. Inferior articular facet right in here. The whole process right there. Kind of seeing the pattern there? All right. Lumbar vertebrae is going to be the next region. Okay. So we have 5 lumbar vertebrae. They're going to have the biggest and thickest bodies, all right, but they will have a small. Look how long, speaking of spinous processes, look how long the spinous process is that comes off here of the thoracic vertebrae. Now, this is a superior view, so it's really tough to tell. It doesn't look like it's that long. That's only because it's angled down into the page. But they're long. They have the longest spinous process, all right, are the thoracic vertebrae. The lumbar, they're kind of blunted, okay, but they have the largest vertebral body. All right, they do not have any costal facets. Why? No ribs, no rib articulation, right? And they don't have transverse foramina. All right, so we will not see any holes in their transverse processes. Okay, let's take a look. Here you go. All right, so again, we've already labeled a bunch of this. Here's the vertebral body. Here's the vertebral foramen. Here's the pedicles on either side of the vertebral foramen laterally. And you have the transverse processes coming off to the side. Here's the spinous process directly off the back. The lamina are on the posterior margin here of the vertebral foramen. And then here you have your superior articulating process. And then the smooth portion here is the superior articular facet. Pretty good? Feel good about that? It's a lot, I know. You got time. You got time to study. Let's look at it from the side. You haven't seen this view yet. All right, look how blunted that spinous process is. It's not very long, not like a thoracic. I love this though. Usually when I make my own tests and give them in class, this is usually the view that I give for the inferior articular process. It's a beautiful articular process. Okay. Okay, so up here we have our nice superior articulating process. The smooth portion of it is going to be the facet. And then this whole region here, that's the pedicle. All right. Let's finish up the spine here. And if we're going to finish up the spine, we got to talk about the sacrum and the coccyx. All right. So here's the sacrum. All right. It's a triangular shaped bone. Okay. So down at the smaller end, that is referred to as the apex. The base is the superior portion. Okay. So this bone sits on the back side of your pelvic cavity there. All right. So again, and then the coccyx will be that small little bone that hangs off the bottom of the sacrum there. So the top is the base, the apex is the bottom. So here's your sacrum. All right. And if you look closely enough, you can see where those fused vertebrae were present. All right. That fusion occurs between 20 and 30 years of age. All right. And the vertebrae that articulates superiorly with the sacrum is the L5 vertebrae. So take a look. Here is the superior articular process, all right, that's coming off of the sacrum, and that articulates with the inferior articular process of L5. And so there's a disc that sits right here. That's the most herniated disc in the spine. That's the L5S1 disc. Okay? That sits in between the L5 vertebrae and the sacrum there. Okay? Don't have to worry about that. You don't need to label any of that. Show you a couple structures here. All right, this portion here of the sacrum that comes off the side, that's called the sacral ala or ala. And then this base-like structure at the top is called the sacral promontory. Now this is an anterior view of the sacrum. So these foramina here are referred to as the anterior sacral foramina. Now, if we flip the sacrum around and look at it from the backside, then those same foramina from the backside are referred to as the posterior sacral foramina. We're just looking at it from the back. And we can't see on this view, but the hip bones will articulate on either side here. Okay? And that part of the sacrum that articulates with your hip bones, this surface here, I'll outline it for you. There you go. That is known as the auricular surface of the sacrum. So when the pelvis is, when the hip bones are connected to the sacrum, you can't see that surface because that's in the joint. Okay? That's the lateral view. All right, last bone here of the spine, the coccyx. All right. Really nothing terribly exciting about the coccyx except for this fact right here. Several ligaments and muscles attach onto the coccyx. So if you damage those muscles or ligaments, they'll yank on that coccyx and you'll get tailbone pain. All right, it's very difficult. So that's one of the things that people don't realize. They're like, I got pain around my tailbone, and I have to run through a list of questions for them. Did you do anything? Did you fall? Did you hit anything? I didn't fall directly on it, but something hit me from the side. Well, then you hurt those muscles and those ligaments, and they're yanking on that tailbone, and it's causing that problem there. All right, so here's where the coccyx is, all by its baby self. All right, Herniated discs, like I was saying, think of it as a donut, okay? So at the center of our donut is the nucleus pulposus, right? You get a weakness in the annulus fibrosus, that fibrocartilage, and then the disc material squirts out, right? And if it squirts out in a specific area, like in your neck, you can get arm pain, shooting pain down your arm, weakness in your hand, numbness and tingling. If it occurs in your lumbar spine, all right, you can get pain down your leg. Same thing, muscle weakness, decreased sensation, numbness and tingling, okay? So it really depends. So cervical herniated discs will cause pain and discomfort and symptoms in the upper limb. Lumbar herniated discs will cause pain and other symptoms into the lower limb. I don't disagree with the definition here on there about sciatica. Sciatica is pain that goes all the way down to your foot. You can have a herniated disc. Your L1 or L2 disc can herniate, and it can put pressure on those nerve roots, and you can get pain that goes just down your thigh. All right, and that's still a disc herniation. Okay, you'll also get low back pain in that area, right? And then if it's in the cervical region, you'll get neck pain. All right, let's finish up and talk about the thoracic cage. Okay, and then we'll be done. All right. So the last part of our axial skeleton involves the thoracic cage, right? So it is made up of the thoracic spine, and that's going to be found in the back, all right? Then the ribs come off of the thoracic spine laterally and then will articulate with the sacrum that's anterior. So the thoracic cage is made up of the thoracic vertebra, the ribs, and the sternum. And what's its job? Protection. Not only that, right, a lot of the muscles that help to manipulate your upper extremities, your chest muscles, your back muscles, attach onto the thoracic cage. Okay? So it has a protective role, but it also serves as a site of attachment for many of your muscles. All right? Not only for your stomach, and I shouldn't say stomach, excuse me, the abdomen, like the rectus abdominis, all right, but you'll have pectoral muscles, chest muscles, back muscles, and then some of the muscles for your upper extremity will attach onto the thoracic cage there. Okay? All right. So let's start off and talk about the anterior component of your thoracic cage, the sternum. Okay? Also known as the breastbone, right, is made up of three structures. The top, most superior portion of the sternum is known as the manubrium. All right, and it has this notch in it. It's almost kind of like a rhomboid-shaped bone. All right, and there's a notch on either side, here and here. And that's where your clavicles attach onto. What's your clavicle? That's your collarbone. So this notch in between here is known as the suprasternal or jugular notch. I'll show you right there. Suprasternal, all right, jugular notch. I'm going to come right back to this. Let me just wrap up this other stuff here. All right. So the second part of the sternum is the sternal body, okay? And that's the site for your rib attachment for ribs 2 through 7. So above it, it articulates with the manubrium. Below it, it's going to articulate with this structure called the xiphoid process. And finally, the last part of the sternum is the xiphoid process, right? And that's the inferior tip of the sternum. All right, so that's what we're going to see here. Here's the manubrium. Here's the body of the sternum, and this little pointy thing, that's the xiphoid process. And you can see, all right, that the ribs don't directly articulate with the sternum. The cartilage that they actually articulate with does. All right. So you can see here, all right, here's the manubrium, here's the body, here's the xiphoid process. We'll break this down in a moment. We'll talk about the different types of ribs, true ribs versus false ribs and floating ribs. All right. So here are the three parts of your sternum, okay? The manubrium up top, right? Then you have the sternal body, and then the xiphoid process down here below. And then you can see that here. All right, last part here, the ribs. How many ribs do you have? What? Did you say what?
24.
I thought you said 4. Yeah, you have 24 ribs. I was waiting for someone to say 12. It's like, no, you have 2 pairs. All right, so you have 12 pairs. So yeah, you have 24 ribs. Okay? So believe it or not, ribs are not considered to be long bones. You think they would be, but they're not. All right? They're flattened bone. Okay? So they start, and it's important that you know this, they originate or begin in the vertebrae, specifically the thoracic vertebrae. All right? And then they'll actually articulate and join up with the costochondral cartilage, and then that cartilage will then articulate onto the sternum. Okay? So the first 7 pairs or ribs, 1 through 7, are known as true ribs. You want to know both names. True ribs and vertebral sternal. Look at the word. Vertebral, meaning they come off of the spine. All right? And these ribs are actually, their cartilage will directly articulate with the sternum. Okay? And we call that cartilage costal cartilage. Okay? So that's what we call these true ribs, all right, vertebral sternal ribs. They come off of the spine and they directly articulate, or their costal cartilage directly articulates with the sternum. That's 1 through 7. All right? You don't want to confuse that, because some of you, depending on which questions you get for the test, will be asked this. Okay? 1 through 7, true ribs, vertebral sternal. All right, so if I look here, I'm going to come back to this slide here. You can see, all right, here's rib 1, 2, 3, 4, 5, 6, 7. All right, it's costal cartilage. All right, all articulates directly here, all right, onto the sternum. Here and here and here. 1 through 7. That's why we call that the true ribs, or the vertebral sternal ribs. You guys got that? That too bad? Okay, okay. Almost done. All right, the next grouping of ribs are going to be ribs 8 through 12. We call those false, because their costal cartilage does not directly attach to the sternum. Instead, all right, their costal cartilage is going to attach to the costal cartilage of the true ribs. Okay? So keep in mind, they do not attach directly to the sternum. So we have 2 subtypes. All right? So the first 3, okay, ribs 8 through 10, we call those vertebral chondral. So check it out. Vertebral, okay, they originate off the thoracic vertebrae. Good. But they end up, chondral means cartilage. Means that these ribs will articulate, or their costal cartilage will articulate not on the sternum, all right, but on another costal cartilage, specifically of rib 7. Okay, vertebral chondral. Then our last 2 ribs, 11 and 12, you probably heard this term before, floating ribs. Okay, also known as vertebral ribs, but you notice there's not a second part to the name. It's because they don't articulate with anything. All right, so they originate off of the vertebra, but they don't articulate with any cartilage or bone. So they float out there. Okay, that's it. They have no relation to the sternum whatsoever. They don't directly attach to it, and they do not, all right, attach onto cartilage, another cartilage. Okay, so you can see here on our posterior view here, here's ribs 11 and 12. They just float out there. Okay, but 8, 9, and 10, their costal cartilage is going to articulate with rib 7 costal cartilage. All right, let's just label the ribs and we'll be done. All right, so we're going to talk about these structures right here. The head, the neck, the tubercle, and that'll be it for what you need to know. So, you do need to know that the end of the rib that has the head on it is known as the vertebral end. And then the other end of the rib is going to be known as the sternal end. I'll show you a picture there. Okay? So you have a knob at the end of the rib, and that's going to be the head. Then you're going to see another knob on the rib that's close to the head. That's the tubercle or costal tubercle. In between the head and the tubercle is going to be the neck. Let's show you. All right, here's the head right here. Here's the rib or costal tubercle here. This area in between is the neck. Okay? So where the head is, that end of the rib is called the vertebral end. And then here where you see the rib is kind of flattened, that's the sternal end. So be careful. I've seen people do this. There'll be a question, it has the arrow pointing to the head, and it says, what end of the rib is this? And the person puts the head. I'm like, you knew it was the head, that's good, but it wanted to know if it was the vertebral end or the sternal end. If there's no words on it, it's pointing to the head, rib head. Okay? First thing is first, look directly at the question and make sure that there's no words typed on that slide. Okay, last slide. I just wanted to show you this because this shows you how a rib actually articulates with a thoracic vertebra. Here's the rib. You can see the head articulates with the body. Then the costal tubercle will articulate with the transverse process here. The neck doesn't articulate with anything. But you can see how that one rib can articulate twice with the vertebra. All right, that's it. Man, that was a marathon. We didn't even get around into the lab identification. Don't worry about it. We'll get that next class. I'll run through the slides real fast. I know. I know, that's a lot, Candace. You got most of the labeling in there. I'm just going to run through as a quick review on the next class. All right, I hate to do this, but I'm going to stop recording here, and I know I'm going to lose everybody. I think I just lost everybody. Oh, no, maybe not. Any questions about anything? All right, please don't forget to sign out. All right, if you have questions, always ask, email me, whatever you would like. Everybody at home,